to the 374 since the outbreak of this, my prayers and condolences go out to you. As of yesterday, Albany County, we hit a milestone. 50.4% of Albany County people have received at least the first dose of the vaccine. 36.3% of the population has been completely vaccinated, which is also good. This is an important milestone because one of every 2 residents now has gotten the first dose and are on their way to getting the second dose, which is good. Compare that to the statewide, it's 43%, and full vaccination is 29.7%, which is also, we're above that. As of today, we've administered over 53,564 first and second doses of COVID vaccine. Albany County alone has now administered 33,839. Thank you, Dr. Whalen, and your team. Awesome job. And we had our second dose clinic yesterday. 969 shots were administered. We also had our first clinic yesterday, and unfortunately, we only had 319 doses of Pfizer vaccine were administered. So we are hitting that wall, which we need to talk about a little bit, and I know Dr. Whalen probably talk about. We had the demand, we didn't have the supply. Now we have the supply, and we don't have the demand. Most people who want to get the vaccine have received the vaccine, and now we need to continue to educate and to get people out there to want to help us get the vaccine, and I'll get into that in a second with other stuff. But out of yesterday's pod, we started doing walk-ups, so we had 56 people walk up who didn't pre-register or anything, so that really helped out. And if people want to get back to any type of normalcy, if they want to get back to getting kids in school full-time, or, it was great we had that protest against Dr. Whalen and I with the sports, I think it was a couple months ago, I can't even remember, whenever it was, to have the sports parents out here and telling us to open it up and let their kids play sports. Please, help us get these kids vaccinated. And we can get kids back in the classroom. If you want to have any type of normalcy for colleges, and the colleges and SUNY, Chancellor Malatras and all the SUNY presidents are doing a great job getting their student population vaccinated as they come back and as they've left. We need to do the same thing. So I'm going to say this, and I'm going off a little script here, to the principals, to the superintendents, to the school boards. This is really for the school boards. Help us educate these kids. Help us get these kids vaccinated. The pod in Bethlehem was a huge success. We had over 400 kids, high school kids, get the vaccine. And then even before that, there's like 100 and something that got it before the 400. There's only 700 students. So guess what? That school is over 70% vaccinated for the fall coming into next year. Well, this year, but next school year. I can't say that about the other school districts. We need your help, school board. We need you. You want to have kids in there. People want kids back. Parents want kids back. Please reach out to our website. Go to CDC. Go to the World Health websites. Educate yourself. I know there was a lot of hesitation with the J&J. I know that was a huge setback for a lot of this, and I know a lot of parents just want the one shot, one and done, as they call it, and you're fully vaccinated in 10 days. I get it. But any shot that you get in your arm is a shot closer to us being back to some type of normalcy. It's not done with us. Just ask Tony Presenti, what happened out in Utica. Dance competition, the TU, we read it out there, but the TU did a story on it. And, it broke out with these kids. And these kids ended up getting it. It was the biggest cluster they've had since the beginning of this in a long time. So it's still here, parents. There was a young kid in one of the hospitals locally, very young kid. It's still here, and when I said that person that passed away who was 40 years old, it's still here. It's not done with us. And with the warmer weather coming, more and more people are going to go outside. Please help us, help you. We had a pod today in Cohoes right now. It was going on earlier. We have one in Green Island today with a partnership with Assemblymember John McDonald of Morris Pharmacy. John, thank you for helping out with all this. And on Saturday, we're partnering again with Colony EMS to help more Shaker and South Colony students get vaccinated. I was at that pod last Saturday. They didn't get as many kids as they thought. So again, I know Albany High's doing one. I talked to a couple parents that said it was too much paperwork. I go, yes, they do. And I have to say this, I didn't realize this, and maybe Dr. Whalen could talk about it too. I didn't realize the students do have to give their Social Security and their health care card, because the independent ones do need it to fill out the form to go forward. We don't. I don't believe we do.
No.
We don't. So it's covered for us. But if you go through your school or you go through some of these smaller pods, they go through your insurance and they get reimbursed. So you do have to give that information up. But it's not a lot to fill out. And if you're having a hard time filling it out, we have to take care of that. We will make sure, if you have an issue, call my office. Call 211 United Way. Call the United Way. They'll help you walk through it. They'll help you understand it, because we do want to make the process easy for you to go forward. On Saturday, we have pop-up clinics at a Baptist church. Thank you to the partnership with Mohawk Ambulance. They've been great. We have our third pod that will be in Ravina-Queeman's Selkirk School District. Jay Bertel from Crestwood Pharmacy, thank you. He did the one in Bethlehem. He was going to do one in Albany, but they went with Whitney Young. Jay's been a great partner getting out in the community and making it happen. Jay, thank you so much for what you're doing. And as you know, too, the state of New York left UAlbany. They went to the old Lord and Taylor's, building in Crossgates. Makes it easier, air conditioning, easy parking in your shop, and just walk in. And they also finally loosened up the pre-registration and all that, so you can just walk in and get the shot if you're there. So again, please go and do that. It's so important that we reach the 50% mark. I was happy. I was hoping we were going to hit it about mid-April, and I was hoping, and I gotta stop betting with you, Dr. Wellen. I keep losing. We had a bet last year we'd be done, by December, and here we are. And I was hoping by by June she'd be done with the second shot clinic, and really have some type of normalcy for her department, who've been on the forefront, and we'd be there. But the way people are not getting the vaccine now, it's alarming, and we need to educate people and encourage them to get that, and again, get into it. We need to get that population under 30. It's what Dr. Whalen and I have talked about. We put on the whiteboard when we brought that up, and about the number. So please, again, do what you can to help us. So Dr. Whalen, when we left the last time, actually had a neat idea. We were joking back and forth about it. How do you educate? How do you get the message out there? We have another PSA commercial that's going out. But she was talking about getting to the kids, the 16 and above, and we both have daughters that are 16 years old. So they like to torture us on Instagram, I think, at times, without us being aware of it. When my daughter asks me to do a funny dance move, and the next thing I know, I'm on Instagram, and I'm like, who'd you share that with? But again, it was a great idea, so we ran with it. And so if you got your first shot, we're actually going to post a video or photo on Instagram explaining why you got it, encourage others to do the same. And we created a video from yesterday's vaccine clinic at the Tom June Center to kick it off. So please, hopefully the video works. Let's see what happens. 59 weeks, Andrew. Pressure's on. It is.
Getting the COVID vaccine shot is so important. You can even pre-register, so when there are appointments, you'll be notified.
COVID-19 is still here, and I got my shot because I can't wait to see my family and friends.
I got my shot today to worry less and visit family more.
I got mine so I can bring my family to this great place to see a show, a concert, or a sporting event.
I got my vaccine because it's important to stay healthy, happy, and safe.
I got my shot because I am a baseball coach and I like to protect my kids.
I got mine.
I got mine.
I just got mine.
I got mine.
I got mine.
It's time for you to get your shot. I got mine.
So you get yours too.
So the challenge is out, and Dr. Will and I are going to challenge everyone here in Albany County and throughout the Capital Region. Go to Instagram, submit it to us, put it on there, and we got our shot, you get your shot, and explain to people why. Thank you to the Chancellor for letting us take a video of him and taking the shot in the arm. So to Jim and to everyone that participated, thank you so much. As of today, there's 23,618 cases of COVID-19 in Albany County. to date. We had 41 positive cases today, 79 the day before that, 39 the day before that. So it's like a roller coaster. We go up, we go down, we go up, we go down. Our 5-day average of positive is 52.8. Yesterday it was 58.6, which that's gone down. Our 7-day average, which is still kind of high, 2.9. So we got to watch that. The 7-day average for positive in the capital region is 2.1, so we're definitely a little bit higher than that. There are now 483 active cases. There are currently 1,159 people under mandatory quarantine. Yesterday that number was 1,215. Of the new positive cases, 30 had close contact. 1 was a healthcare worker. 0 reported travel, and 10 did not have a clear source of infection. As of today, 23,000 people, 135 people, have tested positive for the virus and had recovered, which is good. 56 new recoveries since yesterday, which is also good. Unfortunately, we had 3 new hospitalizations overnight. 20 people currently in the hospital, which is, we're getting back down to a good level, lowering back down. And yesterday that number was 20, as I said. There are 5 patients currently in the ICU. Yesterday there were 6. Despite the good gains we're meeting in vaccines and everything else, it's still here. COVID's here. I don't want to sound like a broken record. I'm not here to worry people. It's like I said to you before, I talked to Dr. Venditti, and we are going to see a little bit of a spike increase going forward, especially with the warmer weather. People, please continue to do the right thing. Wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. We'll get through this, but we're only going to get through this in a partnership, working together. And if you see something differently that we can do, or a different message, please be part of the solution, not part of the problem. I'm okay with criticism. I think after 59 weeks, I think we're used to it, and we just have to get through this together. And we can, and we are getting through it together with people that are doing the right things and continue to do the right things. So please, I just want to make sure everyone does the right thing. For those who want to get vaccinated, go to the state-run sites. The website's 1-833-697-4829. Like I said, they're doing walk-ups. You don't need to pre-register. We're all doing walk-ups. And United Way, the 211 hotline, call them as always. Go to our website, albanycounty.com, and you can see everything going on. And just remember, again, please, we got that whole thing we're doing on Instagram. We got our shots going out there. Help us. We need your help. And we will be launching next week new ways we're going to be doing different pods and different things throughout the area. And I'll get more into that on Monday, because we're crossing our T's and dotting our I's, but we have to do a different approach and continue to change the game, so to speak, to make sure people are getting the vaccines and educating people. But Dr. Whalen, please.
Good morning. So yes, yesterday we did have a successful second dose clinic, and between first and second dose clinics we're able to get out an additional 1,200 vaccines. But as the county executive indicated, our first dose clinic was very different in character than we have had to date. Even with walk-ins, we did not reach capacity. And I think this is signaling a shift that we're seeing not only in Albany County but throughout New York State, as people that were very interested in getting the vaccine, people that are early adopters, people that are confident in the medical science, stepped forward to get their vaccine. And now we have to work on those that have been waiting or that are uncertain. The question about access and availability is something that we have been at the forefront of trying to meet since vaccines have become available. And again, I know almost every time that I speak, I really just promote praise of our Medical Reserve Corps and our staff who have showed up week after week to assist members of the public. They're on their feet for 8 hours at a stretch and dealing with large crowds of people that we are keeping socially distanced, and ensuring that we can answer questions and provide a service to give people confidence, and that has gone really well. It's gone really well. I know we have been up here talking about what it's like to go through a pod. I know that We have represented again and again the positive feedback that we have had from the community. But there are still people out there that are uncertain. And I want to speak to that uncertainty a little bit, because I think uncertainty is become a large part of all of our lives for the last year under COVID-19. The uncertainty is whether you are going to be able to resume normal life. The uncertainty is whether it is safe to see your family members. The uncertainty is whether or not you may become ill yourself and how this could affect your family or your loved ones. The uncertainty has been, is this something you could be transmitting unknowingly? And this uncertainty has taken a toll on all of us. It has obviously changed the rules for life as we know it. There have been tremendous impacts on the economic, on the professional, on the mental health front, and on the health front. And each and every one of us has been impacted on that at some level. Each and every one of us. So as we've said since the beginning, there are really two ways to get out of this. The way forward is through immunity. And the ways to get immunity are to become ill and sick. And there is the easier way of getting immunized. And even for those that have had COVID-19, because it's still a new disease that we're studying, we don't know how protective and how long the immunity is, so we're still recommending those people get vaccinated. Vaccination takes away the uncertainty. It helps all of us and moves us back into a place where we can look at resumption of normal life. And I know that many of you still have questions about the safety and the efficacy of the vaccine. Just this week, I spoke to someone and asked why they hadn't been vaccinated. And I heard, well, the first dose of the COVID shot gives you COVID. So there's a lot of misinformation out there still. And I think, as the county executive indicated, people need to hear the right information from multiple sources. COVID vaccine cannot give you COVID. COVID vaccine helps your body produce antibodies so that you will not get infected. People are worried about the side effects of the vaccine. And yes, sometimes the second dose of the vaccine can make you feel a little under the weather for a period of, a few hours, sometimes for a day. There can be an associated low-grade fever with that, and that fever is your immune system reacting appropriately to produce antibodies. That fever does not come with the symptoms of COVID. It doesn't come with a cough. It doesn't come with shortness of breath. It is not something that is expected to land you in the hospital and potentially put you on a ventilator. So it is much milder than the course of COVID. I encourage people to think about the path forward out of uncertainty. And in particular, we are targeting the younger demographic, people that, both of us have kids in their teens and 20s who are very involved and invested in spending time with their peers, as all people that age should be. And this is an important season. There are graduations. There are proms to look forward to. There are sports and athletics that people really want to be involved in. And the way forward to be able to do this safely is through vaccination. I think, again, my highest vote of confidence to the public is the indication. As I've said from the beginning, I wouldn't recommend anything to the public that I would not recommend to my own family. All 3 of my children have been immunized, and I do that because I believe in the science, and I believe it will protect them. I've heard a lot of people say, well, why should I get immunized if I'm just going to protect myself, and I'd rather get sick with COVID? Well, let me tell you something. It's not just you that you're making decisions for, because Everyone that gets vaccinated can contribute to herd immunity, and we need to get to that 70% mark, and we're at 50% now. So you're actually not only doing something for yourself, but you're doing something for the community. You're doing something to help us all forward out of uncertainty. Please speak to your physician, speak to your pediatrician if you're a parent concerned about vaccine. We look forward to partnering more and more with practices in the community so that people can be vaccinated where they get health care. Access at this point is great. We have access at local pharmacies, at grocery stores that have pharmacies. We are going to continue to have pods, and we are going to continue working with partners to have smaller pods where people live, work, and play so that we can obtain as much coverage of the community as we possibly can. We remain committed to vaccinating those that are homebound and those that are homeless. We want to touch every sector of the population to move us forward from this time. So please, if you are still uncertain, speak to someone that you trust that has expertise in this. Speak to your physician, speak to your pharmacist, and arm yourself with the right information so you can make the right decision for yourself and for all of us. Thanks.
Thank you, Dr. Whalen, as always. And again, I want to remind everyone, too, other things in life go on, and we have to continue to move forward in a positive direction. So this week is Earth Week. Yesterday, of course, was Earth Day. We're focusing on protecting our natural resources, fighting for climate changes. I've continued to say this time and time again. I want to be the greenest county in New York State and the nation, and we should strive to do this every day, to be good caretakers for the next generation. So, but I want to talk about a great opportunity that we put out there to come up with different ways of helping us out and to design a bag for Earth Day. And a reusable bag design contest we did for the 3rd grade through the 5th. And throughout Albany County, and we did get so many great people to submit different pictures that they send and different stuff, and I got to say, it was hard. They brought it to me, and I said, I'm not making that decision. So I left it to everyone that's been going through them all, but I got to see a variety of different bags, and I loved every one of them, and the fact that 3rd graders and 5th graders were coming up with such good ideas. But I'm happy to announce that Kylie McGinnis, who is in the 3rd grade at A.W. Becker Elementary School in Ravina-Queen and Selkirk School District, is our winner. Congratulations, Kylie. Great job. Love the picture. Love the little saying. It's hard to see there in the picture, but there's a great saying around there. And her submission's on up there. The slogan is Love, Protect, and Reuse, which was awesome. This design will be printed on our reusable bags that will be put out through Albany County to ensure the residents have access and can save money going forward. So the winner, Kylie and her class, is going to get a pizza party from us. So to everyone in that school, in her classroom, not the full school district, in her classroom is going to get a pizza party. So thank you. And thank you to everyone that got involved with this. Thank you so much, and it's encouraging to see that this next generation is definitely going to be on top of it. I'm also excited to announce that Albany County's latest piece of equipment, our first fully electrical mower, as we continue, and you're going to see great announcements in the coming weeks about some of the strides that we're making to have that less of a carbon footprint on our area as we go forward. To Lucas in my office for economic development, but other things that came up with the grant, and to Lisa and her crew at DPW. It's going to be useful. It's a pretty cool, and I can't wait to see it in use. So please, we're going to bring green to a whole new level in the county and continue to work in that direction and continue to improve things for the residents of Albany County and to educate people as we go forward. So I also want to thank everyone on that. And I want to always encourage people to go to our website, albanycounty.com, to view all the different testing locations across the region, pre-registration, everything related to COVID-19. Please go out and get tested so that number's dropping down again. We need people to get tested. Please go out there if you think you have it. It's still here. Our mental health support hotline, 518-269-6634. I got to get Dr. Giordano back on to talk about that. Numbers are going down, which is good. You know, it means people are coming to grips 459 weeks later of the new world we're in and how business and everything's going to operate differently. But we're still there for you if you need it, especially for your children. Please, by all means, parents, take the time. Brothers, sisters, take a step back and talk to your siblings and understand things are different. Our 24-hour sexual assault hotline is, as always, 518-447-7716. And, again, thank you to everyone doing the right thing. Please wear your mask, cough into your arm, and clean your hands and stay 6 feet apart. I do want to say before we end it and take any questions, the opiate settlement came out yesterday in the state, and I see they're getting $21 million going to New York State alone. I'm president of our opiate settlement on a national level, and actually just had a meeting yesterday at 1500 on all this stuff and where the litigation's going. And we always said we wanted to change the cohesiveness. We're the smallest county involved at the lawsuit at this table. And I can go back 5 years ago when I took this fight on, and no one in the state bothered because they didn't think we were going to win. And to me, it wasn't about the money. It was about changing the culture and the way these pharmaceuticals pump out these drugs and the way that these drug companies have abused the people and caused all this damage and loss of life. I'm glad the state woke up 2 years ago because when they saw dollar signs. And one of my biggest concerns with this was that this money not be used to plug money we already spent, to use this money for different resources to help people. If you look at insurance carriers, and I'm sorry I'm getting off this a little bit, most people don't have insurance. And if they do, to go to rehab, you're lucky now to get 3 days, 5 days, 10 days. You got to fight your insurance to pay for that. Most of them have relapses. Most of them aren't ready. Most rehabs work for people to go away 30, 60, and 90 days. You don't even hear about that anymore because no insurance wants to pay it. This money should be utilized to think outside the box, to pay for rehab for these people that have been damaged the most and make sure they don't have an expense tied into this, not plug money that's already being spent and using that money elsewhere. That's what I was afraid of, but again, it's out of my control. Just like Mike Heim took our money from ODA. But please, as we go forward, please, to the constituents of New York State, talk to your assembly members, talk to you senators, explain to them why this money should be used to offset that. But again, most importantly, we do need to change the culture. We have changed it, but we will continue to change it go forward. Thank you. Be safe out there. If there's any questions.
So I have a few different questions, but County Executive McCoy, I want to start with you. Obviously, last night we saw Albany police kind of clear out that encampment in front of the South Station. What is your reaction to that, and do you have any feelings on Mayor Sheehan or Chief Hawkins' leadership? Do you wish they had acted earlier, or do you think their response was appropriate?
It's easy to play Monday quarterback, and no questions fairly would be answered by Mayor Sheehan and the Chief of Police Hawkins. And look at protests are for a reason, to hear things that politicians or things change culture to go forward. And what happens is when you have good people going out to make great changes, and changes we should have done generations ago, get lost in translation when these bad people go out and do things they shouldn't do. Like I said this before, burning stores down, looting stores, wrecking properties, burning cop cars, and trying to break into the police station. That took away from the 50 or 80 or 100 people that walked and did a peaceful march and sent a peaceful message for change, just like Dr. Martin Luther King did for many years. And I always think about what he would do, what he would think about what's going on in this world today and the way we're handling all the protests. And I know there's a lot of pain and hurt, and I'm not going to try to defend any of that, and to say the way we get forward is by doing this. And I believe in the First Amendment, you do have the right to protest. I've served in the war. I'm still serving in the military, and this is what we defend, so people have their rights. What they did wasn't right. You look at the mission, the city mission. I talked to Perry Jones, who's the pastor there. You have a homeless shelter. You have a shelter for homeless women and children. You have right behind where they embedded these tents is a building that no one even talks about, that Perry Jones and the City Mission turned into apartments for people that moved from the City Mission side to getting into apartments, to keen in their control of their life, to step out of there to eventually get their own apartment. And they had to deal with all this. That's not right. It wasn't right that they had to be hearing loud whistles and everything else going on. And listen, I personally, I stand by the mayor, and I understand why she let it go. But again, as a citizen of Albany, I would like to see that even be closed down. It was a city street. It shouldn't have been shut down. People don't have the right to shut down a street or shut down a section or government or police station. The men and women who work in that building have the right to come in there and not be afraid of their lives or park in their cars. So, I mean, I could go on about it forever, but I just think that, it takes away from the message, and we're making so much ground going forward. I want to focus on the people that are out there every day trying to make a change, Citizen Action, BLM, people that are out there doing it and getting it done, not the bad apples that just want to go and do these protests. Or not protests, but take it to a different level, I should say.
Thank you. And my second question is kind of geared towards both of you. You were both talking about the TU Center pod, the first Pfizer dose. I'm curious as to what happens with those doses that aren't used. Are they reallocated? Do they go to waste? And also, if you could just speak about what the policy is. Future pods, will you be having this walk-in system as well?
So we haven't wasted any doses so far. We work with a lot of community partners to make sure that we can either reallocate or plan other efforts to get the vaccine out. And, we work with our regional hub, which is Albany Medical Center, which does help a lot as well with coordination. And the county executive's office has great staff involved that are also looking at partners that we're working with to reallocate. So, as soon as we find we have extra doses, usually at pods previously they were only extra doses in the single digits, and we would get people in. Even last night, when you open a vial, you want to make sure that you get it out. We were, at the last minute, we had some people come across the street from, one of the sub shops that came in to be vaccinated, so we didn't waste a single dose in a vial. So those extra doses, we'll have plans for them, and we're working on that today, and we'll be working on that next week. I think we will certainly go forward with having walk-ins available, but that is not going to be the total answer. It is certainly helpful for people that have issues with signing up online and have issues with paperwork. We do not take insurance information. When you show up to our pod, you need a driver's license or something that says, who you are and where you live. And after that, there are no questions asked. There are no charges. You just get your vaccine. We monitor you, and you go and you get an appointment for the next dose. So it's going to be challenging, though, going forward because, on this morning before the press conference, I heard from other members of the Hub Coalition that many of us are now in the same boat, that there are extra doses of vaccine. So we want to do everything that we can to make sure that those are utilized.
Any other questions? It's all right. It's all good.
So obviously we're waiting to see if the J&J vaccine gets put back into action. Are you concerned at all if that does get put back into the sphere? Are you concerned that maybe if you have a pod in the future with J&J that you're going to get less of a turnout? And how do you, specifically with that vaccine, how do you overcome any fears that people might have?
Right. So, I think we're waiting to hear what the federal health authorities are going to decide on that. We know that J&J has been reintroduced into the European market and is being provided there. There may be limitations in terms of which population get it. We know that the risks that we've heard about occurred in a very small subset of people. So whether it is limited to people that are not in that subset will remain to be seen. We know that with J&J, there were a lot of people that really wanted that vaccine because it is the, quote, one and done. And you don't have to schedule a second shot, and your immunity comes as soon as 2 weeks after you obtain that shot. So I think that there are still people that are interested in getting it, but I think the education is going to be very important, and there's going to be reassurance. Again, it's important for people to know that the J&J is formulated differently. It's not an mRNA vaccine. Pfizer and Moderna are, and Pfizer and Moderna do not have any evidence so far of similar rare side effects.
That's it? All right. All right. Anyone else have any questions? Again, thank you everyone out there for doing the right thing. Please wear your mask off into your arm. Clean your hands. Stay 6 feet apart. We're getting through this. Thank you.